Hello and welcome to Denslet, a channel for intelligent and curious people like you who are searching for everything under the sun. And I'm here to answer your questions as honestly as possible, of course. And in this channel, I sometimes talk about human sexuality, but mostly on human psychology. And today, I'll talk about one psychological disorder that affects not only older people but also the younger ones. You may have heard the word hypochondriac. Now, what makes a person a hypochondriac? And what does this word mean, hypochondriac? It's a kind of disorder, psychological disorder. It's called illness anxiety disorder. Why it is called illness anxiety disorder? Because now symptoms of illness anxiety disorder, these symptoms involve preoccupation with the idea, because it's an idea of illness, isn't it? Preoccupation with idea that you are seriously ill based on normal body sensations, such as a noisy stomach. Look, sometimes when we eat something heavy meal kind of things, there is a noise generated in our stomach. It's called noisy stomach. Okay, it's not an illness, but people with illness anxiety disorder or a hypochondriac person will always think that, oh, it's a big disorder, big something is happening inside my stomach, I must see the doctor. And they keep thinking like, oh no, there are a lot of difficult things, grave, something very grave, something very serious kind of illness is there. Minor signs such as a minor rash, they think, oh, this rash, it must be very terminal kind of things, I must see the doctor. Now, look, what I am trying to say is, don't take these persons lightly or ignore their complaints. No, of course not. You need to take it seriously, of course. But before that, you need to know the signs and symptoms. These people are worrying, they always worry that minor symptoms or body sensations, as I called, as I just said, that minor rash or a stomach, noisy stomach. Minor symptoms or body sensations mean you have a serious illness. Being easily alarmed about your health status. Finding little or no reassurance from doctor visits or negative test results. Test is negative, but they are not reassured. Oh no, test is negative, but then I must test again, or I must visit the doctor and ask for more advice why the test comes negative, kind of things. Worrying excessively about a specific medical condition or your risk of developing a medical condition because it runs in your family. Suppose in my genetic order or in my family lineage, a disease sometimes appeared in the past. So, if there is some minor sensations which may have some similarity with that illness, I started thinking like it must be genetic, so I have got it. Having so much distress about possible illness is that it's hard for you to function. Okay. It's also a symptom. Repeatedly checking your body for signs of illness or disease. Frequently making medical appointments for reassurance. You have got a negative test, right? So after 1 month, you again go and test it. Got negative test. Then you go and test after 15 days. So these are all kind of illness anxiety disorder, right? Frequently asking or making medical appointments for reassurance. They always want to be reassured. No, 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 it's okay, nothing happened. Or sometimes they avoid medical care for fear of being diagnosed with a serious illness. That is also a very grave concern for the for the members of the family. Avoiding people, places, or activities for fear of health risks. Oh no, I will not go there. No, no, I will not see that person. She is ill or kind of things. Maybe I will get that virus. Kind of fear is inside the mind, walking inside the mind. Constantly talking about their health and possible illnesses. They constantly talk about illness, and they love to talk about illness. They love to discuss illness in detail, and they always think that something is happening in somewhere in my body, so I must see the doctor. Frequently searching the internet. Now internet is there. The internet age has already come, and internet is the most powerful tool in the world. Internet is the most powerful tool at present in the world. So they are searching internet for causes of symptoms of possible illnesses. Now it happens, right? Our life is too big, and there are so many things that will happen, that will take place. Sometimes good, sometimes bad, and we have to carry our life like this. We have to live like this. Live with such people, but we need to take it seriously, of course. Again, I repeat that take these people seriously because it's a kind of illness anxiety disorder. So it's a psychological disorder, and you need to treat these people first of all. And whether for treatment or for any kind of things, I would suggest that since the symptoms are related to health problems and they're complaining about it repeatedly, it's important to be evaluated by your primary care provider, right? Every family has a primary care provider, isn't it? A family physician, we call them family physicians. You must talk to your family physician about it. And if, and of course, they are experts. If they feel that, okay, it should be treated, then they will treat it accordingly. If this has not already been done, then they will do it accordingly. According to the situation, they will take the step. If your provider believes that you may have illness anxiety disorder, he or she may refer you to a medical health professional, because you know there are experts who will treat this type of disorders, specifically this type of disorder, better than other physicians. I mean, general physicians, isn't it? Specialists. So since it's a kind of psychological disorder, you need to go to the specialist, and your family physician will guide you in that way, guide you to the right way, and take you to the right person. or send you to the right person. So again, I repeat that there are signs and symptoms, and the list is quite long, you can see. But you need to take it seriously. You need to take appropriate actions and talk to your primary health care provider. Thanks for watching. Thanks for your time. And I have forgotten to tell you that if you have not subscribed yet, please subscribe my channel. And if you have already subscribed and supporting Wood and Slate, many thanks for it. Your subscription means a lot to me. So again, thanks. Take care and stay safe.